everyone. Thanks for joining us today. I'm Sumi Das, host of the Pass the Ball online event series. Welcome to Healthcare Reform Uncovered, the Rock the Vote National Healthcare Forum. We've got a great program for you today. It's going to be really informative. As you're probably aware, healthcare reform bills are currently being debated by Congress, and we're going to get under the surface of those reform bills today. We're going to talk about how they affect young people in particular, and also what's at stake for you. Now, today's forum is going to be conducted rock the vote style. What does that mean? Well, that means it's going to be civil, it's going to be respectful, and we're going to give you a chance to ask your questions. And it's going to be informative, which means we're going to have different points of view. We're not here to push an agenda. We're not here to proselytize. We are going to let you make up your mind for yourself. Now, as you are aware, naturally, there are many opposing points of view around this hot topic. It's elicited a lot of emotion, which we've seen on the news reports. And this forum isn't going to pretend to be the end-all, be-all for information and viewpoints. The fact is, specific healthcare legislation is being hotly debated among our elected officials on the Hill right now, literally as we speak. And this is a confusing issue, but we hope this event can raise the right questions so that you can understand what's on the table. I mean, after all, it's our lives and really the lives of all of our loved ones that we're talking about here. So let's start by introducing our panelists today. From Los Angeles, we have Pete Wentz from Fall Out Boy. And from Washington, D.C., unfortunately, Secretary of Health and Human Services, Kathleen Sebelius, couldn't make it at the last minute because her presence was required in Senate negotiations on this very topic. But we are delighted to have with us Tina Chen. She's the director of the White House Office of Public Engagement. And also from Los Angeles, we have Heather Smith. She's the president of Rock the Vote. Our program today is going to last 1 hour. Each of our panelists will make a short presentation, and then we're going to take some questions. And these are questions that are sent in from all of you. So remember, if you have a question during the session, you can send it from the dialog box on your screens. We'll pick among them and try to respond. And this is important. If you have specific ideas about how to engage your friends and family around passing affordable, quality health care reform, share them now and after the discussion on passtheball.com. I'm going to start by passing the ball to Heather Smith from Rock the Vote. Heather?
Great. Thank you so much, Sumi, and thank you all for joining us today. We're thrilled to have Pete Wentz from Fall Out Boy here with us, as well as Tina Chen from the White House Office of Public Engagement. Some quick background on Rock the Vote. We were started 19 years ago, and our mission is to register, engage, and build political power for young people so we can have an impact on the issues that affect our lives. And right now, that's incredibly relevant in the area of health care. Our aim is simple. We need to help ensure that young Americans are considered in the health care debate that's happening as we speak. So today's forum is a chance for us to explore whether health care reform will be a good deal for young people. Young Americans right now, we're the most uninsured age group in this country. We are living and breathing the health care issue. Too many of us hope every single day when we wake up that we don't suffer an accident or an illness that will put us deeper in debt. And for those of us who do have health care, we're facing higher and higher premiums and out-of-pocket expenses as health insurance companies are raising their prices, and that needs to stop. The status quo is just not an option anymore. You can see the stats for yourself. 18 to 29-year-olds, most uninsured age group in this country. In addition, more than 30 million young adults between the ages of 19 and 34 went without health insurance in the last 2 years. 2/3 of uninsured young adults between the ages of 19 and 29 went without any sort of care that they actually needed in 2007. 56% of uninsured young adults between the ages of 19 and 29, they're actually full-time workers. They're full-time workers. They're employed. 56% of those people without insurance. They're just not getting coverage through their employer. And in fact, young people are twice as likely as older people not to have health care insurance through their job. And finally, 1/3 of all young adults in this country report problems paying for their medical bills. And 1/4 of all young people in this country have medical debt. That is a huge burden, especially amongst us young people who are struggling to pay off college, pay off debt. To add healthcare debt on top of it is incredibly significant. So Rock the Vote got involved in this healthcare debate with the help of all of you out there, and our role in this reform process is twofold. First, we needed to work to make sure that folks like Tina and the members of Congress and the White House knew that, yes, young people care about healthcare. We maybe don't have well-funded lobbyists, and we don't have millions of dollars to run ad campaigns, but with the help of our members and young people around the country, we scrapped together some money, and we put an ad up on air on MTV and BET and Comedy Central to really raise awareness and ask all of our young people in this country to step up and say, yes, we care about healthcare. That's been a huge role for Rock the Vote, and I'm going to show you the ad that we ran right now.
When you're young, it kind of feels like you got the world on a string.
You feel invincible.
But you're not. Life happens. Recently, I had to have some excess nipples removed. All covered because I have insurance.
Recently, I needed stitches after cutting myself while trimming my afro. All covered because I have insurance.
But we're the lucky ones. 18 to 29-year-olds are the most uninsured age group in America. And without affordable health care, you could be in for a lifetime of hurt.
Go to rockthevote.com and demand action. It's time for the powers that be to cover more than just their own asses.
You should have those nipples removed.
So I said we have two roles. That was our first, raising awareness. But our second is actually taking the stories from young people, the actual stories and the actual voice of young Americans, and amplifying that within the halls of Congress and the White House. The stories you all have shared with us are heart-wrenching, depressing, and absolutely outrageous that these things can happen in our country. Here are a couple of them. There's Krisha from New York, who I've actually gotten to know fairly well through this process. She was a senior in college when she was diagnosed with thyroid cancer. She was still covered by her dad's insurance plan, and she received excellent and prompt medical attention, the surgery, and the therapy she needed. But 2 months afterwards, she graduated from college. She was kicked off her father's plan, and despite applying numerous times to insurance companies, time and again, she was denied coverage. Krisha told us, essentially because I needed insurance, I was not eligible for it. Then there's Amy from Kansas. She was kicked off her parents' plan at the age of 18. She was diagnosed with kidney failure at 19. After a 2-week hospital stay, Amy was handed a bill for $40,000. She had to file for bankruptcy, and the hospital takes 25% plus interest of her paycheck every month still. Apparently, being 18 and making $18,000 a year in America wasn't enough. And finally, Jim from Pennsylvania, he was denied 3 times because he has high cholesterol and high blood pressure, which runs in his family. He had a good job at a small firm, but they didn't offer health insurance. While Jim's able to get insurance for his wife and child, he remains exposed. And he told us, quote, I don't know what they will do if something happens to me. The stories are countless, but at least there's help, we hope, on the way. So the healthcare reform bill we're fighting right now to ensure that it helps people like Jim and Krisha and Amy. Here's how it's all working. I'm going to do the super fast civics lesson because I feel like I've been talking for a really long time. But here it is. Ready? The House right now is taking the 3 bills that they've passed out of committee and putting it into one bill in the House. On the Senate side, the same thing's happening. There's 2 bills that just came out of the Senate committees that they're merging together into one final bill. The House will vote on their final bill. The Senate will vote on their final bill. Influencing what's in the bills is right now so that we're sure that we get what we want. Those 2 bills come together in what's called a conference committee, and they get merged into one final bill. That final bill has to go to the House to get passed, the Senate to get passed, and once that happens, to the desk of the president for him to sign it into law. So it's happening fast, and that's what still needs to happen. As we look at the bills that are making their way through Congress, there's a couple things that we've found and kind of dissected that really will impact young people, and we're really fighting hard for all of you to make sure that the bills have this stuff in it. One, it has to be affordable. If they're going to make young people pay for health care, we have to be able to afford it. You heard the stories. That means assistance to pay for the premiums, capping out-of-pocket expenses and co-pays, providing a public option that will compete with the insurance companies so that the rates actually stay low, and making sure that young people who are struggling right now in our economy can afford the insurance that they're being asked to buy. Make it affordable. Second, allow young people to stay on their parents' plans through the age of 26. This is a huge deal. It'll provide insurance to 1 out of every 3 uninsured young Americans today. And the House actually just announced that it's going to be in the final House bill, so that's good news. And 3, end discrimination of pre-existing conditions and gender. Do you know that in many states, if you're a victim of domestic violence or if you've had a C-section, those are considered pre-existing conditions, and you can be denied health insurance because of it. Discrimination based on pre-existing conditions or gender has to stop. So, what's the real health reform bill going to look like? Will it have these things for young people? Are there other questions that all of you might have about what reform means for you? There's a lot of questions, and Tina Chen from the White House is going to tell a little bit about how the White House and the Congress is addressing health care and hopefully answer some of your questions. So, Tina, thanks for joining us.
Heather. Thanks. It's great to be here, sort of virtually, as I sit here in D.C. Before I sort of go to my comments, I've got a statement from Secretary Sebelius that she wanted me to be sure to read and convey to all of you. So let me just do that. From Secretary Sebelius, I'm disappointed that I have to miss the Rock the Vote web forum on health insurance reform tonight. But I have a decent excuse. I'm attending meetings with senators as they work to merge their 2 bills, just like Heather described, and bring us one step closer to achieving health insurance reform this year. It's always exciting to hear from young people who are engaged in the political process, especially about an issue as important as health care. I look forward to working with Rock the Vote to deliver a health reform bill to the President this year. While I regret missing the event tonight, I've been heartened by the conversations I've had with young people around the country who understand the urgency behind achieving health insurance reform. And as Heather just pointed out, Americans between the ages of 18 and 29 are more likely to be uninsured than Americans in any other age group. That's why so many of the young people I talk to are strong supporters of the reform that will help all Americans by giving people with insurance security and stability, providing insurance to those who don't have it, and slowing rising costs. More than anything, young Americans know that the status quo doesn't work for them or their families. They know they are the ones that are going to have to live with higher costs, less coverage, and poor health outcomes if we don't make any changes, and they're determined not to let that happen. So, Secretary Sebelius says she wants to thank you for participating in this chat. Thank Heather and Pete and Rock the Vote for taking your questions and discussing this critical issue. And that's from Secretary Kathleen Sebelius. Let me just add a couple more things to what Secretary Sebelius laid out and Heather has. As Heather laid out, this is an exciting time. We are closer to achieving real health insurance reform than we ever have. This is an issue that's been debated in the United States Congress since Harry Truman was president, so for generations now, and we are closer than ever before. And as we get closer, it gets tougher, and that's why we need everyone to speak out about this. So what's some of the real information about what's in health reform for you? Well, as Heather laid out, it's going to provide security and stability for young Americans, for all Americans. There are tricks right now where even if you have health insurance right now, the insurance companies use to deny you coverage. They can cancel your coverage if you get sick. So just like Krista in the story that Heather told, you can get sick and then you find yourself actually losing your coverage just at the moment when you need it the most. They can put a cap on benefits so that in order to pay for the care that you need if you get sick, you actually have to spend your way into bankruptcy. And maybe it's not you, maybe it's your parents or your family. I've got an additional story here of Julia from Minnesota who talks about the fact that her family has no health insurance. Her husband has had to take a job, away from home to try to get some coverage for them because they've already spent themselves into bankruptcy because of a serious illness, and their 19-year-old daughter is leaving college right now to go home and take a minimum wage job just to try to keep the family afloat. There's stories like that across the country. They can refuse to renew your coverage because of a pre-existing condition, again, like in Krista's story. And that doesn't have to just be a serious health condition. I've got a story here of a young woman, Lisa from Colorado, who talked about actually it's Lisa's the mom, and she talks about her son who is age 22, aged out of the family's health care plan, and because he had strep throat, was denied insurance coverage, can't find insurance coverage to buy because he had strep throat, which is a pre-existing condition. And there's real gender discrimination that goes on. Not only what Heather described, which is being pregnant or having a C-section or being a victim of domestic violence, being the kinds of pre-existing conditions that in some states allows insurance companies to deny you coverage. It also means that if you are a healthy 23-year-old young woman, you pay 150% premium. If you can find the insurance to buy it, you pay 150% more than a healthy young man because of what's known as gender rating. All of this, everything I've just talked about, would be outlawed under health insurance reform that's been proposed. And these are all essential pieces of the principles the president has laid out as things that he supports and he feels are important in any health insurance bill that will get to his desk. The kind of coverage, the fact that young people 18 to 29 go without coverage, the statistic that Heather laid out is even more important right now because as Secretary Sebelius was here, I know the other thing she would mention because she's been out there, you've seen her on the airwaves right now, talking about the H1N1 flu. And H1N1 affects young people. You are in the target population that needs to get vaccinated, needs to get treatment, and yet here you are in the largest segment of the population without health insurance just at the moment when you need it. So that's what we're trying to change. How will we change it? All of the bills that are pending all have a concept of a new health insurance exchange, where instead of having complicated papers and lots of different plans, there's actually one place. It'll be on a website. You can go, you can compare plans, and those plans are going to be affordable because if you need it, there's going to be tax credits to help you purchase that health care, and the plans themselves are also going to be affordable. So that's going to really change how, if you don't have health insurance, you can buy it. And if you have insurance, where you run the risk of some of these practices that we've just described, those are going to be outlawed so that the insurance that you have now will be more stable and more secure. But we need your help. We need your help in doing this. It is also the president's commitment to do this without adding to the deficit because we know that's your future that we're worried about, and it is his commitment to do this without adding one dime to the federal deficit. So, as I said, it's your future. It's our country's future. We need your help in doing this. I want to thank you for dialing into this, for what you're doing and what you're going to continue to do in the coming weeks. And now it's really my pleasure to turn this over to Pete Wentz, whose dad I know from Chicago and who my son will be just thrilled that I'm doing this. So thank you, Pete.
Excellent. Well, hi. I feel as though I'm probably the most unqualified person to be in this forum, and I have a bunch of papers in front of me, but I'm probably not going to say anything off the papers. I think that one of the important things to note about the debate of healthcare reform is that there are a lot of people out there trying to make this issue more complicated, purposefully or accidentally, and I think it's very simple. It's not a partisan issue. Everyone deserves the right to insurance. If you look at one of the most popular phrases from the Declaration of Independence, it's the right to life, liberty, and pursuit of happiness. Life, health, So that being said, when our band was just starting out, we were in a tour van, and I turned 23, came up off my parents' insurance, and I think that one of the reasons that 18 to 29-year-olds are among the most underinsured is because I was in a van touring, and my parents were like, we're fine with that, but I had to make the decision between paying for health insurance or putting gas in the van or buying a new amplifier or promoting my band, Since then, our band has obviously gone on to be able to do other things and be in other places around the world, and we've gone to countries where they have universal health care, and places like Canada and France, and seen it actually work, and not in some kind of scary way where the government is controlling everyone, but see it actually succeed. And that being said, the last tour I was on tour with Blink-182, and we had catering out with us, and they were just a wonderful team. And there was this girl, Allie, and she had to have her appendix removed while she was out on tour, and ended up with a health bill, I think, of like $47,000. And that's simply because she is not insured and now has to pay that herself. And I think that everyone probably has someone close to them, and that's why who was affected by this, and that's why it is important. This is a personal issue, you know. And while young people have the most to lose from this, you also have the most to gain. So I know that in Washington, people love getting letters. So if you're a constituent, send a letter. People love hearing from you. You know, reach out, talk to your parents, talk to your friends, make your voices be heard. Your voice can be heard and should be heard, because you are the ones who are going to be affected the most by this. So do it. So I got
it. Thank you, Pete. Thank you, Heather. Thank you, Tina. Yeah. We'd now like to lead our esteemed panel in a Q&A. And these were chosen because they represent some of the most frequently asked questions. These are the concerns that are on your minds. So they were sent to us by everybody who's participating in today's session. So this is really what's on your mind. Since we're fortunate to have Tina Chen with us, we're going to pose the majority of the initial questions to her. And as you might expect, many of the questions are about costs. I mean, the economy is still shaky, and people are worried about, you know, paying for all of this. So Roland asks, if the government forces young people to carry health insurance, won't we really be paying the cost to cover older people? Working on the assumption, of course, that older people are in need of health care more often than younger people. And this question is from Jesse. How can you guarantee that coverage will be affordable, and what does affordable mean? Tina?
Both really good questions. And so to Roland's question first, I think this isn't just paying the cost of older people. This is having health insurance available to you when you're going to need it. Whether it's, as Pete's story laid out, if you find yourself with appendicitis, if you find yourself getting H1N1, if you find yourself with a much more serious illness. That's the way insurance works. Everyone pays into it. Because you don't know what's going to happen to you, and the costs then are spread. And the more people actually that are in the system, the more people that are paying, the more affordable it gets. One of the real keys to making this affordable is to get, in fact, everyone into the insurance pool so that it's big enough so that the premiums can be spread across more people, so that insurance is going to be there. So it's not that you aren't, and quite frankly, actually the older people who are Medicare are over in the Medicare system. So if you're worried about trying to pick up the costs for the oldest people in our population, you're not, because they're over in the Medicare system. Medicare is staying as it is, and that's not part of this insurance pool. Secondly, to Jesse's question, you know, how can we guarantee that coverage will be affordable? That's what the exchange is going to be. The exchange is going to be a place where there will be competition, because what the president has said is he wants something where we're going to use the existing system we have, which is a system that is based on private insurance. So we're not going to, you know, just a single payer government system, but we're going to create competition. That's one of the reasons why we've talked about a public option, although a public option is not the only way to achieve that. But we want to have a way in which there will be true competition. We've got several states right now where 80 to 90% of the insurance is actually provided by only one or two insurance companies. So there's really not competition there. The exchange is going to provide that across several insurers where they're all going to have to compete for your business, and that will force them to be more affordable.
Next, there were a series of questions about coverage. For example, Alyssa asks, if I'm 18, how will the bill affect me getting my own independent coverage? And Chelsea asks, will I be able to keep my current coverage if I want it, or will it be up to employers to keep their current policies? Will the current bill make it costly or inefficient for employers to continue to provide quality coverage to their employees? Of course, a lot of people are getting their insurance through their employers. Again, back to you, Tina.
Well, first, if you're 18, how's the bill going to affect? As I think Heather mentioned, one of the features of the of all of the bills that are pending right now is that it will allow young people to stay on their parents' insurance until the age of 26. So you will have that option to do that. If for some reason your parents, you can't do that, then at 18 you'll be able to buy in the exchange. You'll be able to buy affordable insurance. Right now, if you don't have that, you have to go out into the current market for individuals who are trying to buy their own, and that's that market that is both so very expensive on the premiums, but also has those rules like pre-existing conditions, all the various ways in which the insurance company can say, I'm not going to cover you. As to the current coverage, as the president has said before, if you're on a plan that with your employer right now, we're not changing that other than to make it more stable and secure and to get rid of those things like pre-existing conditions, like dropping you from coverage. But if you like your current coverage, if your employer likes the current coverage that they have, employers will be keeping their current coverage. That's all going to stay the same. We're just going to make it more stable and more secure. And so we are not, and what are we going to make it more costly for employers? We actually believe that the reforms that we have overall will attack the overall cost of the entire system. Right now, $1 out of every 6 goes to healthcare costs. And the reforms that we've laid out are also intended to bend the cost curve to make it more efficient overall. So rather than being more costly for employers right now, our hope is that health reform is going to make it more affordable, not just for you individually, but for your employer, because healthcare costs are rising. It's not affordable for companies to stay competitive. It's not affordable for the federal government either. So
are you talking about in the long run, or do you think that they'll be more affordable right away, or is there going to be an initial cost sort of up front?
Well, I think if you're talking about affordable for companies overall, I think there are, obviously it's going to take a while to bend the cost curve on some of the efficiencies, because part of the bill, we haven't gone down into some of the details, but we've got lots of ways in which we're hoping to change the practice of, how people make decisions so they can make more efficient decisions. The bill includes sort of making improvements in health IT. Right now, most health records are still paper records. It's both inefficient for doctors, and there's a lot of administrative costs that are in the system right now. But it also means you can't make as good a
drive, right, Tina?
That's right.
We put all that information on a thumb drive that patients can carry around with them?
Absolutely. Let's look at the ways that we can do that to make it both more efficient and actually make it a better medical system. Because if right now we can't share the information, we can't analyze the data, and if your paper health record is in some other city, at your hometown, and you're at school someplace else, all your health information might not be at the doctor that's treating you when you go to the emergency room at your school. And so people actually don't make the best medical decisions even because we don't have a good health IT system. So that's another investment that we're making.
Well, the next set of questions is about one of the elements of the healthcare reform issue that is really getting people worked up, the public option. Steve asks, what is the public option and why is it important and why is it so controversial? And Corey writes, what if there isn't a public option? How will we move forward to ensure proper health care for the people of America? And again, I'm going to take advantage of your insight, Tina, please.
Well, what's the public option and why is it so controversial? I think the reason it's so controversial is people actually don't understand what the public option is. First of all, it's an option. So it is not mandated government health care. The public option would be in that exchange that I talked about where there's all these different insurance companies and they're competing. There would be private insurance companies, but in addition to the private insurance companies, there would be a public insurance company, if you will, but a public plan that would be operated by the government that would compete with those private insurance companies. So it wouldn't be something you were required to sign up for. It's something that people who are going to be buying their insurance in the exchange, whether it's with their own dollars or with tax credits, if they're below the income levels, then they're going to get tax support from the government to buy their health care insurance. And individuals will be able to make the choice. And they can choose whether they want to go with the public option or if they want to go with something else, another insurance company. The hope is that because you have a public option that can be operated more efficiently, that we will create competition that will force the insurance companies to compete and to become more cost efficient and be more affordable. Now, it's controversial because some people misunderstand it. When they say this is government health care, this is government making the decisions about your health care, that's not what it is. It's just an option. And let's get real. Insurance companies right now are a lot of times the ones who are making health care insurance for people. So this is not, we have rationing of care that's happening, but now it's happening by insurance companies. The public option isn't going to be something that rations health care across the board either. But it's also controversial because guess what? It's competition for the health insurance companies, and they don't like that. And that's why we're seeing such a great pushback from the health insurance companies and some of the misleading reports and information they put out as recently as the last week, as they put out some misleading information about what would happen here. So that's the answer to the first question. What if there isn't a public option? As the president has said, we think the public option is one of the best ways to achieve this competition and affordable health care in the system. But there are other ways, and some of the bills have different mechanisms. One bill actually has a trigger mechanism where if there's not affordability in the system, then a public option would come into play. There's proposals to maybe do this state by state and allowing some states to have it. If you're a state that only has one insurance company, that might be a place that would have a public option. So we're still going to continue to watch those debates as they play out in Congress and see what happens and see what among these various proposals gets passed.
Okay, there were a lot of questions from college students, and they're wondering what's in store for them. Emily and Nicole write, how will the healthcare reform plan affect college students? And Samantha asks, I'm 19 years old and was forced out of my parents' insurance. That's something we've been hearing a lot from just in this event alone. I don't have a job and I can't afford my own coverage. Is there any hope for people like me to have the chance for affordable health insurance in the near future? We're actually going to put these questions to Heather from Rock the Vote. Heather?
Thank you. Great questions. I know, a large number of young people, about a third of us, are in college, and college is actually, many of them require that students have health coverage. And many of those colleges actually offer health insurance plans. And the proposals that we've seen so far and what we're fighting for at Rock the Vote is to make sure that those college plans don't get touched. You can still get the college plans you have. But second, that you can stay on your parents' plan. So if that makes more sense, you can actually stay on your parents' health care plan. And then third, and this is actually a little nuanced, but something I've learned in all of this, is that you can go on your college health care plan, and then you can come back onto your parents' plan, which right now is the big problem because you go on your college health care plan, and then you graduate and you get kicked off. And so you can be on your parents' health care plan, you can go to college and get on that, and you can actually come back onto your parents' health care plan through your 26th birthday. That's what we're fighting for. That's what we're hoping will happen. Obviously, we need all of your help to do that, but that's what the House bill has in it right now, and the Senate bill is close. And that will help both you, Emily and Nicole, but also Samantha, because you won't be forced off your parents' plan at age 19, whether you have a job or not.
So there's a whole other set of questions clustered around taking action. Molly writes, I feel so far removed from the process, which is an understandable feeling given that, all of this debate is happening in Washington, but it really does affect us all. What can the average person do to stand up for affordable health care? And Jamie writes, how do you feel that musicians and music fans can best help in the health care reform effort? Now, I know, Heather, you've got a lot of suggestions on how to take action at the end of today's presentation, but I think this last question has Pete's name written all over it. So, Pete, tell us your thoughts.
Well, I think that anyone who's got a chance to get anyone's attention, or has a chance to get people's voices heard, should stand up and make sure people get involved. I won't claim to have read all 1,500 pages of a bill or get on stage and kind of act like I know what's going on. All I know is that I feel that I empathize with the people who are uninsured, and I believe that everybody does deserve to be insured, no matter how old you are, no matter how much money you make. I believe that it's just a human right that we should have in our country, and I think that the best thing that musicians can do is stand up there and stand behind health care for everyone and encourage our fans to inform themselves. And, you know, if you got like someone like Nick Jonas talking about it, I'm sure there's going to be a whole gaggle of people who want to check out, you know, healthcare or whatever, you know. I could listen to Brad Pitt talk about healthcare all day, I think. Though he's not a musician, but Brad Pitt, you know.
All right. This event is live, and can you get Brad Pitt to join us, maybe?
Yeah, maybe. I'll ask. We'll have Pete ask.
The event is live, and we've got questions that are streaming in from everybody who's participating in the event. So we want to go to some of those questions. In the interest of time, some of these questions may not be verbatim, but we're paraphrasing them, and we are trying not to lose the spirit of the question. The first one we have is from Scott, and he asks, there are a lot of different viewpoints about the best plans and strategies to improve our healthcare system. How's the administration taking into consideration all of these options? And Tina, I'll pose that one to you.
I think what we're doing is we're obviously, as Secretary Sebelius noted, the reason why she's not here tonight is she and our team, including Nancy Ann DeParle, who's the head of the Health Reform Office in the White House, are engaged in discussions right now with folks in the Congress. The President, from the beginning, has laid out several principles, and some of which we've talked about tonight around affordability, around accessibility, and covering everyone who's uninsured, and about, you know, eliminating these, you know, insurance practices. So he's laid out several principles that he has, from day one, said he wants to see in health reform. And we've been pushing for those. There are lots of different ways, as the questioner points out, to get there, and there are lots of people hard at work. In addition to Secretary Sebelius, there's lots of folks at HHS, you know, at their various offices, and within the staff of the Congress, all who, I have to say, worked really, really hard over the last several months into late night hours, constantly round the clock to analyze all of the proposals so people understand them, and that they will meet the principles that we've laid out.
Okay, thank you. And the next question is circling back to cost again. Again, this is something that really people are thinking about. It's weighing heavily on their minds. Are young people going to have to pay higher premiums to support the aging population? Tina, can you take that one?
I think what I said earlier, first of all, let's make sure we're clear that people who are able to be on Medicare right now will continue to be on Medicare. So the aging population, we have a great system in our country that is out there and that takes care of people who are 65 and older who are eligible for Medicare. And so that stays, and that's not part of this health insurance system that we're talking about. So no, you're not paying premiums to subsidize the care for people who are on Medicare, because that system stays intact. So what we're doing, as I said earlier, is I think we're going to spread costs across a broader population. We think there are about 30 million people who are uninsured right now. All of those people will come into a system to be insured. That's a lot of folks to be able to cover these costs across. That's why we want to make this affordable. Affordability still remains a very important part of this, and it's a key part of it. So we're very confident that we can do this and cover everyone and make it affordable. And Heather?
Tina, I feel like we're changing shoes because I get this question like 15 times a day. And I think the biggest concern for young people is they say, okay, it costs me, $400 a month right now, and I can't afford that, so I'm, making the choice not to do it. Will this be mandatory and then $600? And the thing that I've been hearing back, as I've asked that question repeatedly, both to the White House and members of Congress, is that there is a subsidy for people who can't make that level and can't afford that. Can you explain a little bit about what these subsidies are and how they'll help those people who maybe can't afford what the health premium will be if they do have to, make their way into this overall pool?
No, absolutely. That's a good point that we haven't touched on. And in all of the plans, now there are different levels, and so there's different income levels, but within this exchange, there will be subsidies in the form, of tax credits and other mechanisms that will be used to provide coverage for people who can't afford to buy it. And it'll be a sliding scale, so depending on how much you make, what your income is, and whether you can afford it or not, there will be varying levels, starting at no cost to folks and expanding our Medicaid system just so that people who can't afford it at all, we're going to expand that to cover more people. who are poor and can't afford it, to even if you are, you were making money but you're not making enough. A lot of the people whose stories that we heard about earlier, who right now can't make those payments, we are going to provide help and a subsidy to do it. What exactly those income levels are a matter of debate, and there'll be set at different levels depending on what bill, but a very important feature of all of the bills is to also provide subsidies to people right now who don't get it at all to help them buy that coverage. But then in addition, even if you make enough to do it, you can also have the ability to buy into the exchange. If you're a small business owner right now who can't, if you work for a small business, so you work for a restaurant or a store that right now can't afford to do it, they're not poor, they're not necessarily in there for the subsidy, but they don't have a marketplace right now that's affordable. So the exchange, in addition to being a place where people with subsidies can buy their insurance, will also be an affordable place for that business to come in and buy affordable insurance.
Another question for Tina. This one's from Tyler, and he's asking, will a public health plan encourage my employer to drop company-wide coverage?
No. Now, again, there's different forms in which this is taken in different parts of the bill, but the way this is designed is employer coverage right now would stay the same. So employers who are providing coverage right now are not going to be able to change their coverage or drop coverage and go into the public option. So
the way they could work around that, because
Right.
healthcare is a pretty big expense for a lot of employers.
Right. No, employer-based healthcare is intended to stay the same under this, and so we're not changing that. What we are trying to do, and we do understand that it is a big expense, and it's hard for companies right now, is through the several other mechanisms in which we're trying to make the healthcare system more efficient. We're trying to take administrative costs out and fraud and abuse. I think you've already seen, if you've been following the news, some ramp up on enforcement already, even before health reform passes by our administration, to try to bring people who commit health insurance fraud and are taking costs out of the system, that we will be able to bring costs down. So that's one way. Another important way that we're going to bring costs down is right now, all of us who have insurance are paying a cost for the care that's provided in emergency rooms, the most expensive form of medical care for people who are uninsured. Because people who are uninsured, when they get really sick, they still have to go someplace. They're going to get treated in an emergency room. But that's the cost of that coverage is being right now spread through everybody who's got health insurance. And so we're all paying that cost, and that cost will go down.
More questions from our participants today. And just a quick reminder that you can send questions from the dialogue box on your screens. This one is from it's for Heather from Jessica. How do we get young adults educated about the need for health insurance? Many have the thought that they are young and healthy, the invincible Superman complex perhaps, and that they don't need insurance. What about individual mandates to purchase and obtain coverage? Heather?
I just found out that insurance companies actually call us young invincibles.
I was just making that up off the top of my head.
I didn't know whether I should say
the
something
term that was used
back to them or what. But the truth is there is a conventional wisdom out there that young people don't care about health care. And my fear when I started to see that in the media and when I started to hear that, all around was that meant that the biggest losers in this healthcare reform were going to be young people. And it's exactly why Rock the Vote got involved in this debate. No one's out there saying this is a complicated issue. This impacts your life immediately. Things like staying on your parents' healthcare plan will go into effect the day the bill is signed. It will impact your life. It will also impact your life for, the rest of your life. And it will do something incredible in our country where, as Pete was talking about, we will, in fact, take care of our fellow citizens and kind of fulfill this moral obligation that we have as a democratic country. I mean, we're the only first world country and the only democratic country that doesn't have health care for all of our citizens. So it's this opportunity to do that, but no one was going out there and saying this to these young people who, they were making decisions not to pay for their health care. They can't afford it. They're in college. They're struggling to get by. They're twice as likely to be unemployed. Whether or not, what's going on in D.C. around health care isn't at the top of their mind. So I hope with our ad and with the work that we've done, we've been able to elevate this issue and make more people pay attention to it, more young people. I know it's been great to have Pete involved and a number of the other artists that work with us because they have a voice that reaches tens of thousands, hundreds of thousands, millions of people and educates them about this issue. And ultimately, these decisions are being made by the people we elected, and they're being made right now. And it is, far removed, but something that we need to really be participating in because the impact will be sincere. So we're doing it. We're getting out there. We're talking to people about it. And, when we talk about it, people go, oh, yeah, I care about that. But, the work needs to be done to both raise awareness and educate young people on the issue. And I think once healthcare passes, there'll be a ton of work that needs to be done, both by the federal government and by, all of us, saying, here's what this reform means for you, because changes will be immediate, and young people need to know what they mean.
We have a question now from Stephen, and this one's for Tina. Does the proposed provision to raise the maximum age for children under parents' employer-sponsored coverage retain the dependency requirement? Would a child who's 25 years old have to live at home and have the majority of his or her support provided by a parent?
I don't think so. And Heather's shaking her head too, and we've studied this, that no, the proposals as they currently exist would not, that you'd be able to stay on your parents' coverage till 26 and you can be working.
Okay. And this one's also for Tina. Is dependent status required to keep coverage to age 27 under parents' insurance? This sounds like a similar question from Stephen, actually, which sounds like you just answered it. So you don't have to be dependent.
What we've read is that you can stay on your parents' plan. In the Senate side, it's until your 26th birthday. On the House side, it's until your 27th birthday. You can have a job. You can actually leave the insurance and come back to it. You have to be a dependent on their tax status, but actually that's not true. You don't have to be a dependent, and what it is only that child, though, can be on it, not grandchildren or second, cousins or anything like that. But if your parents want to keep you on your plan until your 27th birthday, they can do that.
Okay. The next question we have is from Tommy. What will make the public option more affordable than private options? I'm guessing here that Tommy's thinking, if you have that competition among insurance companies, that keeps the cost down. But so, how is the public option going to be affordable? And this one's for Tina as well.
Well, we think the public option will be more affordable because, first of all, it's not going to be running for profit. So in the first instance, you get a public option. It's not in it to be making a profit. And so that's one of the things right off the top, that makes it lower cost. That's one of the things I think that the health insurance companies are unhappy about because they'd be competing against a nonprofit entity like the government public option.
And because it's nonprofit, then are you able to attract the quality of healthcare providers that people are expecting used to?
We think so. I mean, we think that Medicare, guess what? All the folks who, if you remember back in August when people were sort of, saying, I don't want government, in my health care, but, oh, by the way, don't touch my Medicare. So Medicare right now is, a government-run, health insurance provider, essentially. That's what the Medicare system is. It seems to be working pretty well. And so we do think that absolutely using Medicare as a model, using Medicaid as a model, that yes, we think the public option can certainly provide, quality, competitive health care for folks.
Okay, this next question is about Medicaid. You were just talking about Medicare. With all of this reform, is there any talk of reforming Medicaid? Because certainly people have some issues with that too. This question is from Ashley, and we're going to let Heather take this one.
Maybe Tina, I don't know what's going on the Medicaid thing issue.
Well, there's an expansion of Medicaid in the sense that there's some, and again, I don't recall the details of exactly what the amounts are, but depending on the income levels, there's some part of health reform, part of the way in which we will get the 30 million people who are uninsured on health insurance. So the poorest of those will go on to expanded Medicaid. So in that sense, there's an expansion of the existing Medicaid system. What I I think there are a lot of other issues, and the questioner is probably raising there's several other issues around the way the Medicaid system works. This isn't a bill about reforming the way the Medicaid system works.
Okay, and here's another question, not about Medicaid, but about Medicare, which we were talking about earlier. This is also for Tina. From Judith, isn't it true that Medicare is going bankrupt? How can you say that seniors' health doesn't affect the premiums that young people will pay? Obviously, some concern out there.
Yeah. I mean, first of all, again, it's two different systems
Right.
in the first place. So Medicare is not going to be funded out of the insurance premiums that would be part of the exchange or any part of the system that would be set up under health reform. But the concern about Medicare is real. I mean, the costs are going up in Medicare. So this whole issue of the efficiencies we're trying to put into the system and taking out fraud and abuse, that applies to the healthcare system overall. So that's going to help bring down the costs in Medicare that are projected, like the overall healthcare system, to continue to rise and be unaffordable for us on the government side. But also there's some very specific proposals, and some of these are some of the proposals that there's been some confusion about. There's some very specific proposals to take out, without getting too technical here, but there's a portion of Medicare right now called Medicare Advantage that's actually provided by private insurers. And there's an extra premium paid to those insurers right now that's paid by those people who are on the Medicare Advantage program, but then also by all Medicare recipients. And we are proposing to take costs out of that and to put those dollars back into care dollars. So we're not reducing the care. There's been a lot of confusion about cuts to Medicare as part of healthcare reform. We're not cutting any care dollars, but we are trying to redirect and reduce the administrative costs and the costs that have nothing to do with providing care to people as a way of making that overall Medicare system more affordable.
Okay, and this question is from Haruna. It's not all or nothing. Do you think there's a way to incorporate a national healthcare system, such as what they have in Japan, where the individual still pays a portion of the service treatment? Has the administration looked to other countries to see what's working and what isn't working?
Well, I think overall, remember, this is a debate around health insurance reform that's gone on for about 30 or 40 years. And through that process, there's been lots of things that have been looked at. So to the last question, have we looked to other things? I think everyone has who's studied this. One of the things the president has said is that we have a unique American system here that relies on employer-based and private health insurance. And rather than throwing that out and going to something like a single payer, we are building on that. And so we're trying to build on that. So yes, we are trying to have that. And part of the question is there, some portion of paying for a premium, are people going to be paying? There will be that. I mean, one of the things that we have is, I think Heather pointed out earlier, there's tax and there's subsidies. There's subsidies that will be part of the system, but it'll be on a sliding scale. So that if you can afford to pay more, you're going to pay more, but people who can't will get more subsidy. And so it'll be a mixed system in that way, in which there'll be private premium dollars, people paying their own money, as well as being subsidized in part or in whole by the government, depending on your income levels. And there will also be people paying into the system, buying more affordable health care, who can afford it completely without any government assistance. And so that is sort of if the question is going to, are we having sort of a blended system that way, that is, I think, what we're trying to get to.
Dean's got the following question. Are there going to be enough doctors to cover all who enter the program? Because, obviously if the public option is available, we're going to have more people insured, everybody insured, right? And so are people going to have to wait to see a doctor, or is there going to be enough health care available?
That's a very good question. And I think overall, one of the things that the president has invested in is in more medical training. I mean, part of our 2010 budget includes, more training for medical professionals and trying to encourage more people to go into the medical profession, and not just doctors, but the president has spoken quite passionately about the role nurses play, both in his own family's care and in our healthcare system overall. And so we want to do that. But, right now, we have a very inefficient system. And so we do think that there's going to be care. There's certainly we're already in our current system existing. We have places like rural settings that don't have enough doctors and healthcare facilities. I think part of what we're doing, even in the Recovery Act, has been to make investments in rural healthcare settings, and that's happening right now with some of our budgets. So, again, health reform isn't everything to address what's wrong with our healthcare system. It's a major start, but there's still going to be more work to do, and this administration is committed to keeping at it.
Tina, maybe this can be a pathway for careers for a lot of young people. I know so many people are graduating from school, whether it's from high school or college, and really struggling to find a job. Young people today I think I just heard twice as likely to be unemployed as all other Americans. So perhaps some of the funding in this healthcare bill can really help young people start new careers that both make a difference and, make sense.
That would be great.
We definitely need more nurses. I know that when I was in the hospital giving birth to my daughter, the nurses were thinking about going on strike, and I told them to hold out for a few hours.
Right. Yeah, because they were the key ones. They were the ones that were key.
Not that I don't love my OBGYN, but she sailed in hour 12 of labor. So, right. All right, not to get too personal, but okay. So I know COBRA is set up for the unemployed. This question is from Chelsea, by the way. But being recently unemployed, I can't afford insurance under this program. What other option is likely to be in the bill for the unemployed? Tina.
Well, that's where, as Heather pointed out a little bit ago, we're going to have subsidies. If you're unemployed and you can't afford to pay yourself, then we're going to have not only a place where you can buy affordable health insurance, we're going to have subsidies that will help you do that. So if you can't afford it right now, there's going to be subsidies to help you do it. That's what we mean about trying to make sure that the people right now who can't, but that's 30 million who can't afford to buy health insurance right now will do it. Not just creating that market, but also providing subsidies to help you buy that if you can't afford it.
Okay, and another question here. Will healthcare reform cover older dependents such as my mother living with me? This is from Clayton. And it's also posed to you, Tina. And I know we were just talking about Medicare, and you're also just talking about subsidies. Is that something?
Well, an important part, what we've talked about is, there's a gap that happens right now. For example, if you're, for example, what I've heard stories from people where one spouse, for example, is on employer-based health care. That spouse may be older, so let's say it's the husband, and he hits 65, and his employer then drops him because he can be on Medicare. But guess what? His wife might be 60. And she's not eligible. And all of a sudden, she finds herself unable to be on his Medicare, and there's no employer-based. And now she's 60, and there's no market for her. There's no ability for her to buy insurance right now. Again, if they can't afford it, we'll have subsidies. And if they can't afford it, we'll at least have a marketplace that's a more affordable place where she can buy it.
One last question from everybody who's been participating today. These have been great. And this is to Heather from Heather. What would you say to young adults who are healthy and are afraid they'll be forced to buy expensive insurance, even if it is deemed, quote unquote, affordable, which they don't believe that they need right now? Maybe getting back to this invincible complex, but this time it's coming from, the people who are uninsured versus the insurance company.
I wonder if her name is Heather Smith. I love my parents, but when I travel, I have to check in. It's like, are you the Heather Smith traveling to? And there's 15 options. Heather, I actually worry about the same thing around cost. It's a question that I've been asking repeatedly. I think that this bill will be a first step, and I think that there's some good measures in there. But at the end of the day, it's kind of like Social Security, where I think young people are going to have to pay in to make it work. And we are fighting to make sure that everyone making these decisions knows that affordable has to be affordable, or else you're going to bankrupt the future generation instead of, build a better future for us. I think that there's a little reality check, too. You might not think you need health care insurance, but about 1 out of every 4 18 to 29-year-olds, in the last 2 years went without medical care that they needed because they didn't have insurance. And you just never know. Insurance is for accidents, right, for unintended things. You get pregnant, you fall off your bike, you have appendicitis. So I think Pete broke his foot on stage. Ow. Did you keep playing?
Yeah, stuck in the song, kept playing, and then, but I was able to go see the doctor, and then had a walking cast and played the rest of the tour on a walking cast. So.
Oh, yeah. See, just now I broke my nose. Playing sports, it happens, and I think we'll be bankrupted as individuals if there's not an overall insurance plan for it. So it will take a little getting used to, but ultimately I think it will save us all a lot of money in the long run if the plan that passes makes it affordable and gives us options that are affordable and actually affordable. And I would love for the White House and the members of Congress to actually tell us what affordable means and what those costs will look like. I know that's something that they're working on, but ultimately it'll be a first step, and it'll provide insurance when those accidents happen.
I think I read somewhere today that if your premium is more than 10% of your income, that you are that is who could be subsidized, I guess.
Yeah.
That was the number. I don't know. Is that possible?
I mean, that's certainly one of there. As I said, the bills have different levels in them, and that's one of the things that are going to get worked out. But that is definitely one of them. So that gives you some indication of the levels at which we're talking about. I mean, what Heather said is right. I mean, insurance is there for the unexpected things, and guess what? Even for young people, unexpected things happen, and sometimes it's a broken foot, and sometimes it's things that are even more serious. And we've been hearing stories about people who've gone without care and gone without diagnosis, and get really serious illnesses as a result. There was a study that Harvard just put out a couple of weeks ago that now shows that 45,000 people in America die every year for lack of health insurance because they didn't have insurance, they didn't go to the doctor, they didn't get the medical care that they need. And that can happen to you at any point in your life, whether you're 18 or whether you're somebody like me who's significantly older than 18.
31?
Right.
Well, and it's true. It's 1 out of every 6 young people has a chronic illness already. And whether that's diabetes or obesity, we have health problems as a generation. So maybe 5 out of 6 think it won't happen to them, but I bet at least 4 of them know someone who it has happened to. So I don't know. You don't want to wake up next morning and feel really stupid that you're the person that thought it would never happen to you, because it does.
Covered a lot of ground, and our goal was to be informative, and hopefully we've accomplished that, and some of the murky areas surrounding healthcare reform are a little more clear now. We know it's a really busy time in Washington right now, to say the least. And so I'm guessing that, Tina, you've got someplace you need to be and some other engagements before you call it a night. So we're going to say goodbye to Tina Chen. She, again, is the director of the White House Office of Public Engagement. Thank you so much for being here today and taking time out of your schedule to clarify some of these points for us and answer all of these questions that our participants had. We really appreciate it.
Well, thank you, Sumi. Thank you, Rock the Vote, really, for everything that you've been doing, that you continue to do, and thank you, Pete. And I mean, Pete, you represent just all of the folks who've been signing in and across the country who don't have to do this, but are taking time to do it, and I want to thank you for that.
Thank you.
And Tina, I think as a generation, we feel like we helped elect this president, and it's helpful to have someone from the White House willing to take the time and tell us, what's going on and what did we get ourselves into, and we hope we can continue to have these conversations with you.
No, absolutely. This is just the first of lots of issues that are out there on our plates, and we look forward to continuing to work with you all. So thank you very much.
Right. Well, we have a few minutes left, and we're actually going to turn it over to Heather Smith for the call to action, because now we've heard the information. We want people to think about this, but we also want them to be active too. Heather, how can they do that?
Absolutely. It's a complicated issue, but the consequences for us and our lives are serious. And so we, believe that as a nonpartisan organization, as a nonprofit organization, our role isn't to tell you which side to be on and what piece of legislation to fight for, but instead to stand up and defend, issues of concern to all young Americans. And we need your help to do that. We need your stories. We need you to sign the Yes We Care petition. We need you to get involved. Because what that allows us to do at Rock the Vote is to amplify that in the halls of Congress and in Washington, D.C., so you don't have to. We can go up there and say, tens of thousands, hundreds of thousands, millions of young people around the country care. Here's their story. Here's their concerns. Here's what they need. What are you going to do about it? And how are you going to make sure that young people are really taken into account as these decisions and policies get made? So go to rockthevote.com. Sign the Yes We Care pledge, send your story, send me an email, let us know what you're thinking, what your thoughts are. But if you want to do more, write a letter to your member of Congress. They're the ones deciding this. You elected them just the same way you did the president. You'll get the chance to do it again. Tell them what you think.
Letters.
We'll have letters.
I don't know. I think that one thing that is really important to notice is that when you look at any kind of debate or anything that's going on in general, for example, if you look at the pharmaceutical companies, it makes more sense for them to keep treating an illness rather than to cure it. So if you look at the healthcare debate, I think that it makes more sense for healthcare companies currently to not have competition, because therefore they're the only ones and they can control the market. And it is in their minds, I think, and the people who are included in this debate don't think that 18 to 29-year-olds really do care, but you're the ones who, in my personal opinion, energized the election and elected this president. Therefore, this administration kind of does owe something back to you. And I think that by making your voice heard, it's very important, and you see the other side, or you see other sides start to get desperate and try to confuse issues, and don't let the issue be confused. Like, pay attention to what the actual facts are and make your voice heard, because if you did elect this president, then you should also be involved in any of his policies.
Yeah, absolutely. And, you know, it's...
And Rock the Vote was, like, the best one.
That's sweet. Go to our website, rockthevote.com. We've went around and we looked at all the different sources out there and all the different resources. We compiled it all into one place so you can learn what do these terms mean, what's going on in the debate, who's, doing what, did it all in a nonpartisan way so you can really look at it and make up your mind for yourself. And then right there on the website, there's simple things to do, how to find your own member of Congress, write them a handwritten letter. Apparently those are, it's not the same thing as a typed in one. If you handwrite it, it goes really far. Write a letter to your editor. There's instructions on how to do it right there on the website. Or if you just have 10 seconds, go and sign the Yes We Care pledge so I can represent you. But do something. This is a moment which I think we'll look back on, 10, 20, 30, and 50 years from now and say, this is a moment when our country changed, and let's make sure it changes for the better. So, rockthevote.com.
I'm afraid that's all the time we have today. On behalf of Rock the Vote, I want to thank everyone, and especially Pete Wentz and Tina Chen, for an informative and illuminating session. We're really grateful for their help in providing greater clarity on this obviously complex subject, and we're also grateful to Cisco and WebEx for sponsoring and supporting this national forum. It's clear that our elected officials in Washington have a historic decision ahead of them, and they need to hear from each of us to know where we, the people, stand. So take some of the advice that Heather just gave and go to rockthevote.com. This session is going to be archived on passtheball.com by Monday, so invite your family and friends to watch it. And remember, if you have specific ideas about how to engage others to pass affordable quality health care reform, please share them by posting them directly on passtheball.com. Thanks again to everyone for their participation today.
Thank you, Sue.